it's Dr. Tabony with Indian Trail Animal Hospital. I want to take a moment today to speak about a relatively serious subject, and that is dogs and cancer. So we all love our pets so much, and we fear the day that they might get sick. And pets, just like people, do have cancer concerns in their lives, especially given that modern medicine and great health care at home can keep our animals living so much longer than they used to. So just want to go through some of the big things that a pet parent might notice at home and when we would encourage you to come in. So one of the big things we see in our pets is lumps and bumps. And I'll want to first calm you that many of those are going to be benign. If they're under the skin, they feel soft and squishy. Probably over 80, maybe even 90% of those are going to be benign lumps. They should be tested. We need to prove that they're benign, and there's the percentage that aren't, but many of them are. The reason that we want to test them, even if your pet had 3 others tested that were benign fatty lipomas, is that dogs have a unique lump called a mast cell tumor that is a cancerous concern and does need to be surgically removed. Again, not all of those have to be scary, so they don't have to be very aggressive, but they should be surgically removed, and they don't feel any differently than the soft, squishy lumps that are benign and often called lipomas. So that's one thing with dog cancer is lumps. Many of them benign, they should be tested. Mast cell tumors don't feel any different, but could be a concern, so we need to distinguish between those two in the office. The other thing about pets and cancer are dermal masses. So those little skin warts that you might see on your aging pet, almost all of those are going to be fine. I would say if you have one that is dark, if it's near the lip margin, if it's near a toenail or anywhere near the prepuce in boys or genital areas in girls, then that raises our concern even more. So if you have little ones that are growing on the skin, they can be a problem in their own right because they might lick them or they might get infected. We have to deal with those in different medical ways. But from a cancer perspective, darkness and those locations would be a reason to make an appointment sooner rather than later. The third category really is lymph node or lymphoma type diagnosis in pets. Lymph nodes in dogs sit underneath the jaw here and at the back of the leg, kind of behind their knee. So if you ever feel swelling in those areas, particularly if there's weight loss at home, but if there's swelling without weight loss is still a concern, we should get your pet in to test for lipoma. Last, certainly not least, unfortunately, but the last big category would be cancers that are internal. So some larger breed animals will grow tumors in their spleen. Some of those are benign, but they can still be a problem if you're bleeding internally because you've got a big mass on your blood-filled organ called the spleen. Liver tumors can happen, bladder cancer can happen, but we've got diagnostics that aren't, they don't have to be expensive to assess whether or not these things are going on, and then treatments. I think we often feel, we jump to conclusions. Okay, I see a lump, my pet has cancer, I don't want to do surgery, therefore I'm not going to go have it assessed. But I would really encourage you, if you're looking at this video and thinking that your pet might have a cancer concern, to make an appointment. My hope is that we can give you good news that it's not that. If we do give you news that it is something of concern, we want to work through the options. It's almost never that I say to a client, I'm sorry this is a diagnosis, I'm sorry there's nothing we can do. There's always something that we can do to help, and we want to provide that for you and your pet. Thank you for your time.